it's something didn't go quite right on it there. All right.
And you're a little bit like this because you've got you almost need to set your computer up on a thing because it's coming up
Mm,
at you and it's
we're live. All right. Well, right now.
getting situated.
You ready? So we're back, and we've moved into our live Ask the OT, where we're going to continue really talking about advocacy. I have to say that. Uh, and we're going to see if we get anybody join us online. We're on YouTube live.
Just introduce Ask the OT.
So Ask the OT, where we get a chance to be able to ask the questions that you may be having, or your concerns that you're having with your loved one that you're caring about, where we're going to be able to ask the questions to our uh, resident occupational therapist, Gina Grothoff, and come up with any kind of answers that can help you to guide you through what you're going through. We know what we're experiencing this both on a professional basis and a personal basis. Gina's been working in the occupational therapy field for over 30 years with the senior population, but also now on a personal level of having to care for her father, who's going through some difficult times with his Parkinson's and dementia. So, with no further ado, I want to introduce Gina Grodoff.
Applause, applause, applause.
Ah, the crowd roars. Ah.
So I'm Gina. I'm an occupational therapist. I have worked in adult and geriatric rehab for 32 years and in the Charlotte, North Carolina area. And I have worked in the settings of the acute rehab hospital. I've worked in skilled nursing facilities, nursing homes where there is short-term rehab where people go from the hospital to get rehab to go back home, as well as long-term care where people that need to live in that setting. I've worked in assisted living facilities, on memory care units, and with independent living populations. I've also worked in the home health setting when people get therapy coming into the home. And so, from all that experience, and like I've talked about in some of our podcasts, helping Don with his care when he had a heart attack, however many years ago, and when he went through open heart surgery, and just navigating the hospital has been a new experience for me because that's not a setting that I've worked in directly. And yet now my dad, can we count the number of times? Last year it was 3 times in the hospital with pneumonia. It's 2024, and we've been in a couple times already.
At least,
Once or
yeah.
twice it was just overnight, okay, he's okay, let's go back. And since he moved to a memory care unit, assisted living memory care close to my house, now that I live in Salisbury, and has been in the hospital several times in just a month, and now has gone to a rehab facility to get stronger before he can go back to assisted living memory care. And I'm a strong advocate as a therapist when I work with people because I work in a facility and I am one of the weekend evaluating therapists. So they like to get people out of the hospital at the end of the week. And where do they go? If they're not ready to go home, they go to a rehab center that usually what they call short-term rehab, skilled nursing rehab. It has many names. And so they come in, and a good place will get people evaluated within the next day when they get there. And um, so I help answer a lot of questions. I've been doing this for people. When you come in on the weekend, you don't have the full administrative staff there. So, especially coming in late on a Friday or anytime Saturday or Sunday, you have much less staff there, people to explain things. The case managers aren't there on the weekends, and just to help make that transition. And
Well, and you mentioned the the person there, but let's dig a little bit further into what what are some of the titles of the people that you would need to advocate to? We already know doctor and nurse with that, but what are some of the titles that you might hear of? Let's start out with a hospital.
Okay. So a hospital setting, advocating for your loved one in the hospital. So they're going to have a hall nurse. Sometimes there's a charge nurse and a supervising nurse. Um, there's someone who gives the medication in the hospital. That's usually a nurse. In other settings, it's often what they call a med tech, someone who's just administering medication, but is not actually a nurse. So in the hospital, if you're having concerns, if the nurse is not answering your question about medications, you can ask to talk to a supervisor. One hospital my dad was at, there was a charge nurse and she was great and she jumped on things and helped out. There's also some hospitals have what they call a patient advocate
Mm,
and finding out who that person is because that's larger than just their nursing care. It's if they're not getting their food right at the hospital, if they're not,
mm,
my dad was never given a menu to fill out. They were just bringing him food and they would tell us, well, the dietary was supposed to come up and go through the ticket and ask, what the choices are and what they want. And he's other hospitals, we've done that for him. We've been there to help him. My mom and I were with him almost all the time. Like sometimes maybe we weren't there till 10 a.m., but then we were there through dinner. And towards the end of his stay, the patient advocate, another one came up earlier in the stay, but I was so busy with other thoughts and things I didn't even think about the whole meal issue. And she called herself the get her done person. Um, and she said, we're going to make sure this happens. We're going to get the dietary people are supposed to be doing that. They are supposed to be coming up and giving you a menu and helping you fill it out if they can't fill it out themselves and so that you can make your choices. And there's choices each day. And then most places have other things that can be ordered all the time. Because getting good nutrition is important when you're in the hospital and getting, a variety diet of the different food groups and things. Because a lot of times you wind up eating very different foods in the hospital. So advocating in that avenue. And so it helped to reach out to that patient advocate. So you want to get that person's name and number. At the current hospital my dad was in, there was a weekend advocate person and then there was the weekday one, but it was the same phone number for both. So they gave us that phone number and then that's who we could call. And when they come by, having your list of questions ready. When you're sitting there, have a notebook, have something, write down, use your phone, any questions that pop into your head so that when someone does come in,
mm.
you like, okay, wait, I had a question about this. And you can go through your questions not knowing who you're talking to, but they can help you get it to the right person. Anything with changes of medication, the doctor has to order it. You can request that through the nurse, but until the doctor does the order, it's not going to happen.
Now, are there other ways those hospitals, besides calling it a patient advocate, is there
The
other
nurse supervisor, charge nurse,
customer relations? I didn't.
there
It
could
seemed like I said
be,
anyway.
but there's, the nursing supervisor. You have their main nurse who's giving out their medicines and things, but hospitals often have, you can go to the nursing station, find out where the nursing station is. I can ask questions and they can notify your nurse. When my dad first was admitted to this recent hospital, I went up because he's on thickened liquids and I needed to get that for him. And that's something anybody can do. And a woman got me packets of thickener to put in the drink and, helped me to do that. And I did that on multiple occasions for him. One time I just wanted a styrofoam cup because they were giving him the little packets of thickened liquids come in these little cups. They look like little yogurt cups. And it's like I wanted to pour it into a cup with a lid. And, this one woman, I'm not sure even what her role was, but I said, she's like, oh, just a styrofoam cup? That's all you need? She's like, I can do that. And she's like, I feel accomplished. And then I asked her for something else like that later. And she's like, I'm like, you get 2 stars. You're really rocking it, because
Yeah.
sometimes, they don't get the opportunity to do simple things, and it just, they want to be helpful. They want some, good staff. They want to help you. They want to do what they can. And so being patient, knowing that each department has their job and their role.
Mhm.
When they come to get you for transport to go to a CAT scan or an MRI or anything they have to take you out of the room for, they send a transport person. That is that person's job, is to just get you from one
One place
place to another, right? And they
and
can
talk to you.
and they can often be friendly and nice, but they're not going to be able to answer questions about the procedure, the
Yeah.
results, other things. Um, but good staff will say, I can, this is who you need to talk to for that. Or, each department is designed to do their own job, which is important, right? Um, and yet I find the biggest challenge is the communication between departments can be the most challenging at the hospital. And this is based on maybe 4 different hospital locations over the course of 12 years or more, just the experience of that. And so kind of helping to bridge that gap and to know therapy services. A doctor has to order the therapy services. In the hospital, once they get evaluated by a physical therapist, occupational therapist, it's usually only a couple days a week. The therapist makes that recommendation. And I had the instance of when my dad was in the hospital back in Charlotte. Um, she wanted to recommend 5 days a week, but she normally worked in the rehab hospital and not the regular acute hospital setting. And they don't have the staff to do 5 days a week in that kind of setting.
Mm.
So, I've got to talk to a different therapist and like, yeah, unfortunately, it's usually only 2 days a week. And part of that is having the staff. And in the hospital, the therapists cover the whole hospital. So they're going to see people on all the floors and all the different areas. And their job is really just to get in, to help people get out of bed, do some simple exercises, because they've learned over the years you can't just stay in bed to recover, unless there's some reason that you shouldn't be up moving around. The more and the sooner they get you moving, because the more you're in bed, one day for each day you spend in the hospital bed, it's 3 days to recover from that. And that doesn't even take into account having, Parkinson's, having a
Mm.
broken leg, having a cardiac problems, lung problems, all these other things that can complicate it and make it even slower to recover. So that the role of the therapy in the hospital setting is really, and you might be like, oh, that's all they did was get him out of bed. I'm like, that's a good thing
Mm.
because 30 years ago they would have just kept you in bed
Yeah.
or maybe more than 30. But
And as you've learned, it just makes you weaker by staying in bed.
my dad, I got to tell the story because it just outlines how this goes. His oxygen, he's living in the memory care assisted living. I got a call because his oxygen was 80%. I had gotten to work that day. I was down in Charlotte. And the nurse was like, we got to send him out. Your oxygen level needs to be at least 90%. That's how much oxygen that they put it on your finger to check it. They're checking the oxygen level in your blood. If you're not showing enough oxygen in your blood, that means you're not getting enough oxygen to your brain. That means, you're not going to be able to function. And so this is why they sent him out to the hospital. I drive down, I meet him at the hospital. They do tests. His oxygen level gets back up. He was on oxygen in the ambulance. They didn't even have him on oxygen when I got there. And I'm watching the monitors. It's like, okay, his oxygen's 95, 96%, even like, okay, so they didn't, and that's good that they didn't put him on oxygen if he didn't need it. And monitoring his heart rate, his blood pressure, they did all the tests. Everything was coming back negative. They even on the CAT scan of his lungs, they said it could be a very slight mild pneumonia, but not necessarily. You can have kind of what's a mild lung collapse when you're not up and moving really well. This is something new I've learned
Mhm.
or understanding it on a different level, that your lungs not functioning as well. That's why they give you those, what they call the inspirometer, where you have to breathe in and blow out and make that little bubble go up. What that's doing is exercising your lungs.
Yeah.
Our lungs need exercise just like our arms and legs and the rest of our body. And when you're in bed a lot, if you have Parkinson's and you're in this posture, your lungs don't have the chance to
Mm.
do what they need to do. And when you're not up and moving, they can't fully function. So they never really were even sure, even at discharge from the hospital, that he actually had some slight pneumonia or it was just some mild lung collapse. So, like, they're not even sure what he had. And the day the doctor came in, he's like, I can give him over the counter antibiotics and we can send him back to the assisted living. And I'm like, I was a little concerned about that because he had seemed off to me that the day prior to that. And I could tell he just seemed weak. And he's like, or I can keep him. I'm like, okay, so we can monitor him overnight. And he goes, well, then I can put him on IV antibiotics. So now he's going to get admitted. So now we're emergency doctor exits. Now we get the hospitalist. This is the new name for the kind of
What was it?
hospitalist.
Hospitalist.
So that's just your general
Sounds British.
medical doctor who follows you in the
Hospital.
hospital. So it's, if you need a specialist, if you need cardiology, but then you have the overseeing one. So that doctor comes in, and because he's going on IV antibiotics, they're like, "Oh, we like to do that. He'll be because I was hoping he would stay one night and then get switched to oral antibiotics. We like to, at least 2 nights, maybe three. So once you're admitted, then they want to follow the protocol of the IV antibiotics. He got there at 9 in the morning. I got there, I don't know when I got there, 10:30. It took until 8:30 at night to get him a room on the unit. So it wasn't that the hospital was full, but the unit he needed to go to, we were waiting for our bed to open up. And then you have to wait the transport person to come. So that all took a while. We got upstairs, great nurses, got him settled, got him in bed. I had his list of medications. It is important to have a list of over the counter and prescription medications and the doses. So because of the in and outs of the hospital and my mom keeping up with this over the years, I happen to have a copy on me. I've been carrying around my notebook that says John on it to take care of my dad. And luckily I pulled it out because I needed to leave for some reason. And but I hadn't got to talk to the pharmacy is usually who comes to reconcile their medications and to confirm that they need that. And so that person hadn't showed up yet. So I talked to the nurse and they told me to put it on this clipboard and I did that. And they did come get it when I wasn't there. And then I was able to confirm that. So, the moving pieces of it. You've got
Hmm.
you've got administration who comes down to get insurance information and all that. If you have a DNR, what are these other things you need? Then you have someone typically from pharmacy who reconciles your medication. So they come in to go over what medications he's been taking and then so they have that in their system because if they don't have that in their system, he's not going to get it. And it's important to give any over the counter medications to them because they really need to monitor what he's taking. I've seen family members like give the medication on their own and they need to know exactly what he's taking. If anything changes or happens, they need to know that. But you can advocate. You can say, I want to see that list of what's in the system. And you can talk to the doctor and say, at home, he's getting this. Why are you changing it? So that you know. So having that list was so helpful. And it's a long list for my dad. It's 3 pages, and at least one page of that is over the counter stuff like Miralax and Tylenol and some supplements, but they're important to his health. Um,
Or I
Deep
was,
breath.
yeah, I was going to move on to talk a little bit about the advocates at facilities like nursing centers or like,
Okay.
I didn't know if you were finished with your thoughts, but
Well, I could go on forever. Um,
uh,
yeah. So, okay, so then you're in the hospital. You want to make sure they're getting therapy services. If they're having anything related to their cognition, their mental functioning, they're not their memory is changed from what it normally is. They're having issues talking or speaking, getting words out, or anything with their swallowing. All those services are under speech language pathology, which are often called a speech therapist. But they need to be assessed by that person and they can get evaluated by these people and maybe they determine okay they don't have an issue that we need to address. To get the services that they need, you need the doctor to order it. Then you need the therapist to do the evaluation in order for them to proceed forward with things. Um, so then it's like the case manager They're typically, they used to be called social workers. They tend to be called case managers. That's the person who sets things up for wherever you're going from the hospital,
Transition.
whether you're going home, and they're going to come ask you, what's your plan? Can you care for this person when they go home? And be careful how you answer that, because this person that may have come into the hospital walking, whatever's happened to them in the hospital, if they've gotten sicker, or sometimes people go in the hospital and then they have a stroke, or then something else happens and they get weaker. They're going to be weaker. They're going to have a harder time getting up. They're going to be at a higher risk for falling. And doing their daily activities is going to take more effort. And so before you say, yeah, I can take them home, you need to really see. And the therapist, they come in and they evaluate and they talk to you and ask you questions about what your setup is at home. Do they have steps they have to get
Yeah.
into the house? Do they have to step over the side of a bathtub? Who cares for them? Who normally assists them? And then, like, okay, based on what you're saying, they could do all the stuff themselves now. What I'm seeing now is they need this level of
Mhm.
assist. They recommend, we would recommend going to rehab or maybe going home with home care if have people to support and give that physical assistance. So they will make that recommendation, but they will also talk with you. They will have conversations with you about it, and it can be a discussion. So the challenge with all of this is being there when these people show up.
Well, and you would now I'm not sure if they do it, but would they do home assessment?
Okay, so before we even get there, we're
Well,
still in the
But I mean, but
hospital.
I mean, would a hospital therapist, they
No,
won't do that.
no.
Okay, I just want,
Back up. So, in order to ask these questions of all these people, you've pretty much got to be at the hospital, or you need to get someone to fill in for you and tell that person, if this person comes in the room, if the doctor, the therapist, anybody you want to talk to, call me. You can also tell these people, like, you have to leave, you're going to go get lunch. If the doctor calls, I want to talk to them. The doctors will reach out and call that person who's
Mhm.
the primary medical person involved in a situation. Or like for me, it was me and my mom, and
Yeah.
years ago it was more my mom and me supporting her, and now it's more me. But you have to give that okay for me to get information on the medical records. So if someone is the power of attorney, they have to say, okay, it's also okay that you talk to my daughter or my son. They need that. They need that okay, and then those numbers and names of people. So
And
it
they'll even call you down if you're down in the cafeteria having lunch or if
they
you
might,
stepped
they
outside.
might, and that's where having other support people. But you need to let them know, writing things down. And they will wait a minute. They will, like, say, okay, I will come back, or yes, here I'll call that person to fill them in. Um, And doctors, you can ask, when do doctors do rounds? And depending on the situation, when you had the cardiologist, they did rounds really early. It was, I don't know if it was 6 or 7 between that and whenever. So I got myself there so I could talk to them directly. And with my dad, luckily it wasn't until 9 a.m. But then sometimes it's not till the afternoon. And um, so being there, and there's no set time in the hospital. People are going out for tests. All these things are happening. Like, if your loved one is not getting attention, it's because they don't have serious medical needs, that there's someone else on that hall who's maybe coding, having cardiac arrest or some serious medical condition that's got to get attended to right then and right there. And um, just realizing that they are really doing the best that they can, and yet either being there, putting your name down. Nice hospitals have wipe off boards. I write my name, I write my phone number, I write call me anytime. I tell that to the staff, everybody that comes in. A lot of times they work 7 to 7, at least the nursing staff, but because they work 12-hour shifts, they might only work 2 days in a row, or you're going to see a change in staff. So you have to repeat yourself, and having your list of questions and things to ask. That's why I'm putting together a whole pamphlet on the
Transition.
questions to ask, because okay, so now we're getting into, okay, now what? Now we're going to go somewhere. Where do we Okay, you want to go to rehab, and I've had this happen with dad at other hospitals. These places all have a bed. I need you to pick one by tomorrow
Mhm.
because he's ready to be discharged, because The doctor won't discharge him until he has a place to go. But once he has a place to go and the doctor writes the discharge order, it's happening.
Yeah.
And the push to get people out of the hospital quicker, which is good, in part to get them moving and doing more, but also because care is cheaper at the next level of care. Care is cheaper at the rehab nursing
Mm,
home. Care is cheaper at the home with home care. And so there's this push, and this is something that has been frustrating
mm.
to see because it's not always in someone's best interest. So these decisions get made really quickly. And it's, my mom's, it's like we got to be ready. We got to be prepared. And I can only imagine how difficult this is for the average person. And I see this in talking with family members who've come through it. And so you
Just
can go to medicare.gov and look up facilities. You go under nursing homes. If someone's recommending they go to a rehab, you can put the name of it in there, and we can share this in a link maybe. But it's medicare.gov. Um, find a facility. If you pick nursing homes, if they're recommending going to short-term rehab, you can pull up by zip code, by city. A lot of times they'll give you some actual places. It'll give ratings. It gives ratings 1 through 5 stars. But what's more important than that number of stars is looking at the different levels. So there's a rating of nursing care, there's quality care, there's three different things. But you want to look at that nursing staffing because one facility got 3 stars, which is average, but the nursing care was 1 star. And what
mm,
that means, it has to do with turnover. If you have constant turnover of nursing staff, that's a sign that people don't like working there. It's not an ideal environment. It can, be a sign of how the administration is, because that really makes a difference. Even a facility, someone said, oh, this was awful 10 years ago. Well, it might be very different now because
um,
the administrator, the people there in charge, but it'll show you the ratio, the number of hours per patient. I'm not sure how they calculate these things that shows up on Medicare.gov, but I know that different places have slightly different ratios of um, nursing to patient ratios. How many nursing assistants are there per how many patients and what kind of nursing staff? A lot of places might just have a med tech who's not even an LPN. They're a CNA with extra training. All they do is administer medications. Um, but then you want, having a nurse there. So finding out what the staffing is like. Do they have in-house therapy? How often do they get therapy? How quickly? A good place will, if you get admitted this day, you will get therapy by the next day, at least get OT and hopefully OT and PT. So there's questions that you need to ask about that, about going to that facility, but that's a great resource to look up. And if you know other family members or loved ones who's been to facilities, and it helps that it was recent because things can change, they can change for the worse and for the better depending on who administration is, who the nursing director of nursing is, and some other
who are
key.
who are those other people? Who is the person you would go to? Like you went to a patient, I put parent, patient advocate at the
Once you're at the,
hospital.
so I'm just talking about picking your location of
Yeah,
where to go.
yeah, but
When you're in the nursing facility, there should be a nurse on the hall where they're at, but there should always be a nurse supervisor. The places I've worked on the weekends, there's somebody in the supervisory role. Better places will have an actual nurse supervisor. Some places I've worked, just each department head rotates and they act as supervisor for the weekends. But it's really much better when it's a nurse who's in that role that can advocate and there's always someone always has a supervisor that you can go to if you have more questions and concerns. And a good place will provide you with that information and support you. And a place that's not run so well will not advocate for you to ask questions. And that's not a good place to be. And if you are at a place getting rehab and you are not happy with the care they are getting there, you can request that they move to a different
mm,
facility. I did this for a friend once
no.
and got her relocate. It took a little bit, but you can request to go somewhere else. Um,
Who was it that when your mom was looking around, like who did she talk to initially? Because it was she was more of
when my
a
mom was looking around for what?
for a facility for your dad.
to
The person
to
that she
live
was commute
or we've looked for
Okay.
facilities for my dad many times.
Well,
But
when she was looking for just to live, who was the
oh, so
person?
that's totally different.
Yeah.
So that's totally different. We're talking about short-term rehab, and we're talking about
Yeah.
um, short-term rehab, needing rehab after the hospital in order to go home. So then if someone needs to live at a facility, they need continuous long-term
Yeah.
care. That's a whole nother level. Is that
Yeah.
what you're talking about?
Well, I was just trying to remember the person that she was communicating what her title was. I'm just looking
I
for
don't know
when
what you're talking about though. No, I don't.
when your mom was looking at Terabella, for instance, to move your dad there.
Yeah,
She had a person that she was in contact with she
at the facility.
at the facility. Yeah.
Oh, well, that's the marketing person. That's
Okay.
just if
Well,
if you're looking to move someone into a new place, you call the facility. It's usually their marketing
okay.
person that you
I was
talk
just
to and you
looking at all the
coordinate
avenues
with.
that people have to, whether it's going to
Oh,
hospital or if
that's a
they're
little more
just,
straightforward,
yeah.
but yeah, it's different when you're going for short-term rehab. That's a whole nother conversation. If you're looking to move somewhere, yeah, I see you're trying to just get the titles of who to
Well, I'm
ask.
just looking,
Yeah,
we're talking about advocacy and whether,
right.
in that case, it's also advocating when you
Well,
want to just getting them into a facility,
and that's
not
knowing
necessarily from a hospital, but
and that's knowing the questions to
yeah,
ask.
yeah,
And the questions to ask and who to talk to and to observe the facility and to find, yeah, it's knowing the questions to ask of how the place is run. That's key and we can get into that on a whole different
yeah.
discussion because
Well,
that enters a whole nother world.
but it leads us into talking about the fact that you're, that's what you, that's what you do is help people in consulting with people to help
Yes.
them
So
for those questions or
as a
those,
consultant, my role is doing what I so the therapy world has changed. Medicare reimbursement has changed. And because of all these changes, it has minimized the amount of therapy services that people get and to minimize the amount of time that we as therapists can spend with patients. And therefore, we have less time to do these things that I have always done as an occupational therapist advocating for their care. Occupational therapy is all about returning to your activities of daily living, returning to anything that you were able to do before, to be able to engage in your daily living skills from feeding yourself to being able to take a shower to being able to cook meals for yourself and really beyond that, returning to driving, returning to a job. And so there's so many components involved with that. And part of that is helping them to self advocate. My role as a therapist is to say, hey, you need help. You need to call for the nurse. You know, you're uncomfortable in this position. You need to be able to tell the staff, please put the pillow here. We people who are capable of that, they learn how to direct their self care. That's a part of what I do. And so I would like to do for other people what I've been doing for my dad as giving you this information, helping you with the questions, helping you and different things work for different people, different personalities. My approach to each patient is different depending on who they are, where they come from, you know, their background. I like to find out what they did for a living because it can make a difference. I ask people where they're from. I've moved around growing up. Where you're from in the country affects kind of your mindset sometimes. And so understanding their personality and also their diagnoses, and especially when you've got cognitive impairment. And that can look as little as a very mild cognitive impairment to significant dementia. And then there are different types of dementia that do manifest with different challenges. And so that's where I have lots of expertise on that can help you and kind of helping you it on the one-on-one level of figuring out your own loved one and supporting them and you, but also on a bigger scale of just helping you with the questions that you need to ask and the options that you have out there. And, there are places you can call. A place for mom is a big one. You go on their website, you put what you're looking for. They have people that call you and can identify, well, these are the places in this area, right? And they're good places that can give that information. And yet there's so much more to it. And so if you're really concerned or having questions or just, your situation, it can be really helpful to have a little more in-depth knowledge and support in that area. And so even if I just, spend an hour helping you steer in that direction, or I work with you for more than that, um, how I want to support and help people. And so these are Ask the OT discussions that we will continue to do every couple times a month, but also reach out to us if you want to work more directly with me and have further conversations as we grow the community. We'd love to create a community network of support in addition to coming online to these questions, listening to our podcasts, and
you can find all this, more information about this, about what our next one is, on our website, focusedhealthyfamily.com. And that's our podcast for today, and our SCOT.
be sure to tune in and look at our website for when we have another Ask the OT. If you're interested and you have questions to ask, we open up this for questions for others. Today we didn't have any direct questions, so we were covering a specific topic. But when we have people coming on, literally we'll address the different areas and questions and concerns that you have. You can send them to us ahead of time if you want to send them anonymously. If you're able to join us, you can join us live on the Zoom call or just submit questions through the YouTube channel. Um, and to connect and to share and find, and you can check back to previous Ask the OT where we've had other conversations covering lots of different topics and from when people have called in and the questions they've asked as well as covering different topics. And so glad you joined us. Please come back again to an Ask the OT. Reach out to us through Focused Healthy Family if you'd love to connect with me more and see how else I can